will introduce, and Dana Clark will introduce the speakers and handle the Q&A session. Dana, take it away.
Like to.
And if everyone else could mute and then unmute when questions. Thank you.
I'm only getting, okay. Eileen, I'm not getting me in the big picture here.
You can just start talking, Dana. Go ahead.
Okay, all right. Good morning, and thank you very much, Sarah. And thank you, folks, for joining us today. This event is part of the League's work to increase understanding of the major public policy issues. We promote social and economic justice, equity, and quality education. And we do support responsible government that provides leadership to be able to solve economic problems. Many of us live in Lee County because it's a paradise. Sunshine, beaches, no snow, low unemployment rates, low taxes. Yet other people do not share those same advantages. Many of us are products of a post-prosperity generation following World War II. Our parents fought in a war to guarantee us a safe home, a safe school, an education, religious freedom, and a democracy. Today, our grandchildren are going to schools that are locked, guarded by policemen, educated by teachers, cared for by nurses, other healthcare workers, firemen, social workers, EMTs, many of whom cannot afford to live in Lee County, and they can't afford to provide a home or a rental for their children. And Florida ranks 35th out of 50 states in the inability to provide well-being for their children. Maya Angelou said that she learned that people will forget what you said, people will forget what you do, but they will never forget how you made them feel. And this is important. Our children are our legacy. They're the stamp of what we did when we were here. So today, our speakers will present issues, resources, unmet needs, and then we'll begin a conversation of the steps to improve the outcomes for our children and their families in Lee County. Each of the speakers will give their presentation. If you have comments or questions, please put them in the chat. And at the end of all presentations, we'll discuss the comments and the questions. Our first speaker is Dr. Norrin Dollard, who serves as Senior Policy Analyst and Director of Kids Count for the Florida Policy Institute. Dr. Dollard has years of experience in healthcare research, evaluation of behavioral health issues, and the needs of children and the family in healthcare systems. She has a doctorate in education from the University of South Florida and a master's degree of public administration from the State University at Albany and University of New York. Dr. Dolan, welcome to the presentation.
Thank you so much for that kind introduction, and thank you for taking time out of your Saturday morning to be here and to talk about this very important topic, our kids and our future. So I'm Norrin Dollard and with the Florida Policy Institute, and I'm going to tell you a little bit. One moment, please. Okay, there we go. Tell you a little bit about FPI. We are a nonpartisan research and advocacy group that are committed to advancing state policy and budgets to provide opportunity, improve opportunity for all Floridians. These are some of the ways that we do that. We advocate for smart public policies, and we'll be talking a lot about that this morning. We are very big on building partnerships and coalitions. Our job is very much educating policymakers, the public, the media, making sure they're up to date on what's happening and what the best evidence says about prosperity in a lot of different domains, and I'll talk about that in a moment. We analyze public policy to create those policy recommendations, and this is all on a foundation of high quality, credible research. We do all of our work with an equity and inclusion lens to make sure that all Floridians have the opportunity to thrive. Okay. There we go. So Kids Count, I'm the director of Kids Count, and Kids Count is one of the NEKC family foundations, and it was created to ensure that children have a brighter future. And the Kids Count Foundation in particular is focused on collecting and reporting on critical measures of child and family well-being. For those of you who are NPR fans out in the community, you've probably heard the underwrite. There's a state index that is compares all 50 states head to head, that comes out every year, every summer. So you may have heard of that, and we are a grantee of that foundation. And so we have an index of counties that I'm going to talk about in a moment, but people say, well, so why these indicators? And why these indicators are that we look at education, because it is the foundation for children to enter the workforce and be successful, and for parents to have the means to best support their families. We select these health indicators because they have ramification. Health insurance, for example, has an impact not just in the moment, but over a child's lifespan. Economic stability is really critical to healthy development, and so we include economic stability in our measures, as well as family and community indicators that give a better understanding of the context of where children are growing up and what are the community factors that influence their development. I'm going to just show you these very quickly. I'm sure you can get the recording and go back and look at them closely, but we use a combination of census data and data that's available through state sources. So let's talk about where we were heading into the pandemic. Things were improving. Florida, as mentioned, we ranked 35th out of 50 states overall, but Florida had been making steady progress, although certainly there was work to be done when the pandemic hit. COVID-19 has brought unprecedented hardship for children and families, and those hardships have not been erased as of this point. So there's a lot of work we have to do in Florida that is going on at the federal level, really to trying to shore up and make sure we don't lose ground on the improvements that were being made heading into the pandemic. So that's really should be the focus of investment. So as I said a moment ago, even though we are 2 years into this now, we have not figured out how to fully, mitigate the effects of this virus, as I'm sure you all know. But even as recently as September, nearly a quarter of Florida households reported a loss of income in the preceding 4 weeks. About 20% had little or no confidence in their ability to pay their next rent or mortgage payment. 13% reported that their children did not have enough to eat in the week, past week. And we also have great disparities between on these indicators, with families of color experiencing these losses at higher rates than their white counterparts. Even now, with children returning to school, with daycare and preschools reopening, they have not reopened fully. There are still big disruptions in childcare in school that affect parents and their ability to maintain employment, and also, ensure the safety and education of their children. So 31% of families with children under 12 in Florida reported having had a disruption in childcare, or for school-age children in their education. And you can see that for our youngest children, families with the very young children experience these disruptions at higher rates than their school-age peers. But still, 1 in 5 families with school-age children had been affected by the virus. And this could have been, in the case of little ones, that the childcare closed, or it could be the child had the virus. There's a number of reasons why this might be true, but the proportions are fairly high. I spoke earlier of health insurance, and you can see here over time, since 2008, we had made a lot of gains, huge gains in getting children health insurance, which, as I said, has lifelong effects, positive effects, children having insurance. And these show that before the pandemic, we were already, we had already started to lose ground in getting children health insurance. So this is something we definitely do pay attention to and need to keep working on ways to get more children insured. So those were statewide data, and a lot of those are pulse data, and they're not available at the county level, unfortunately. But let's talk a little bit more and set the stage for some of our speakers to come. Lee County, of the 67 Florida counties, ranked 20th statewide in 2021. So, and that was up a few places from 23rd in 2020. Looking at economic well-being, hold on a second, there we go. We consider children in poverty, and there had been definite improvements in 5 years between 2014 and 2019. Those were better. The unemployment rate was, there had been an uptick in unemployment. Housing cost burden had improved, and what that refers to is the proportion of families who spend 30% of their household income or more on housing, which is considered the standard. And we consider the teens not in school and not working to be the same if it's plus or minus 1% of the preceding time frame.
10 minutes.
Yeah, thank you. As far as education, all of the indicators are better. Young children in school, 4th graders and 8th graders, reading and math had improved, and the proportion of high schoolers graduating had improved, although we do talk, not to confuse things, but we talk about it not, so all of the scales go in the same direction, so we can compare them. And health indicators, Lee County had done better with kids with insurance, teens using alcohol and drugs, Where there are opportunities for improvement are the rate of low birth weight babies has stalled out, as has the number of overweight or obese first, third, and sixth grade students. Family and community, Lee County had improved in 3 of the 4 areas and had held steady with the numbers of rate of children with verified maltreatment. But whatever the ranking, the outcomes in communities are not accidental. Counties with higher rankings have better resource places. There's more and greater investment in quality childcare, education, and things that families need. Counties with middle rankings, which is not you, there is a mixture of areas in which they invest well or not. And so, but let's talk about what we can do. So from the information that you kindly shared with me, looking at the report to the Board of County Commissioners, Herb Marlowe from Analytica had this to say about that resources are an issue in Lee County as everywhere. And it's these resources, the available resources, that limit the abilities to address cost burden or poverty, mental illness, substance abuse, or trauma, which he identified as the key drivers of Lee County outcomes. So what we need in generally are policies that invest in preserving and expanding household supports, ensuring affordable quality early learning, and thriving schools, our workforce, which I know one of the following speakers is going to talk about, and again, health insurance. So specifically, there are things we can do administratively through administrative advocacy at the state level to ensure continuous coverage for kids in Medicaid or kid care, so that people aren't bouncing on and off of insurance. When people fall off kid care, getting them back on as quickly as possible, not enforcing a wait. And so trying to maintain that continuity of care. As far as workforce, the talent hub I read with interest seems to be working well. The suggestion would be to keep an eye on equity and make sure that the post-secondary credentials and degrees are being earned by all racial and ethnic groups in Lee County, and working on dropout prevention and graduation support so that all of your graduates' graduation rates reach 90% for all groups, which they do not at present. Investments, equalizing the cost burden. One thing that's before the state legislature right now is a state earned income tax. Yes, we can do that without a state income tax, and it's called a Working Floridians tax rebate if you want to look it up. Some counties have found ways to create tax streams that support children, such as Children's Services Council, and some do it without referendum. Some are done, Sarasota has done it just through their Board of County Commission, if I understand correctly. And then the last two, pre-K, investing in childcare. We know that childcare providers took a heavy hit during the pandemic, even maintaining staff, those sorts of things. So figuring out reducing costs of care for parents, but also supporting the providers themselves. So there is that availability of quality childcare. And safety net, SNAP, or otherwise known as food stamps, state level advocacy, administrative advocacy. We could reduce the administrative burden for families so they don't have to reapply every 6 months, which would also have a benefit to DCF, the Department of Children and Families, for their workload and having to keep up with those renewals. That would be a benefit to them too. So these are some of the ways that we like to collaborate with community groups such as yourselves. So I will close with that, and we're taking questions later. Thank you.
Thank you very much, Norrin. Our second speaker will be Jeannine Joy, the President and CEO of the United Way of Lee, Hendry, and Glades County. Jeannine has been with the United Way for 26 years. She graduated from St. Leo University with the Bachelor of Arts degree. Jeannine?
Thank you so much. I'm going to touch on a few things. Unfortunately, and I think Dr. Doler kind of touched this, is that right now the data since the pandemic has been really hard to come by, but I can share some of the things with you that we're seeing within our programs. I am happy to say that a new ALICE report, which ALICE stands for Asset Limited Income Constrained Employed. Those are actually those households with income above the federal poverty line, but they're below the cost of living. And that's a huge study that United Way does across the country. And those new reports, which will reflect the pandemic years, should be out in spring. So we're excited when those will come out, but I'm going to share with you what we've seen as far as United Way in general. We run the United Way 211 line, which is an information referral line for Health and Human Services. So people call that when it's not emergency. You still call 911 for emergency, but we help people find the resources available in our community. We've seen drastic increases in the number of people calling the 211 line in needs of assistance. And our highest requests are for rent, housing, affordable housing, and utilities. We direct people to the resources available, but sometimes the resources aren't available to them. And that could be because they're working, they're above that poverty line, but they had one thing happen and that set them back, because the majority of our residents here in Lee County are paycheck to paycheck. And so if you're out 2 weeks because of COVID or anything else like that, it throws a wrench into all your finances. And so we do direct assistance. We do not pay individuals, but we pay vendors. So when they're not going to qualify for rent assistance through the resources available, we will pay the landlord for a month's rent or whatever it may be to get them through that critical time so they don't fall even further behind. Or we'll pay, with LCEC's Power to Share. FPL also has a program as well. We'll make sure their utilities get paid. So we had a record-setting $300,000 in direct assistance that we did in 2021. And that was a tremendous increase because we normally average about 120,000 a year in direct assistance. So you can see that the needs are dramatically rising within our community. In late 2020, we actually worked with the Board of County Commissioners to implement a child care scholarship program, because we had many families that were trying to get back to work, but they couldn't because they were off of work or furloughed or had reduced hours because of the pandemic. And they couldn't afford to put their children in childcare just to go back to work. So we distributed $2 million in childcare scholarships for the second half of 2020. So again, you can see the tremendous need that's been in our community. Our VITA program, which is our volunteer income tax assistance program, which we have over 100 volunteers that are IRS trained and certified. They prepare income tax returns for households that have $66,000 or less a year. VITA in the year, last year, prepared over 7,000 of those returns for residents in our community. And that brought back over $10 million in returns, much needed dollars right into the pockets of our residents. And that was a huge increase. We did about 5,000 returns the previous year. Not only did we prepare their taxes so they could take advantage of earned income tax credits and things like that, but saved those taxpayers over $2 million just in fees they would have incurred by having to pay for those taxes to be done. And this just shocks me, because I said, household $66,000 or less, our average household income for those 7,000 people is $25,000. Imagine trying to live in this community with an income of $25,000. So that's kind of the basis of where we're seeing our needs. And so what I want to share with you now are a couple things that we implemented since the pandemic, or actually right before the pandemic started, January of 2020, that we've seen some great results, and we're hopeful that we can continue this. And the first one is our School Resource Center. The School Resource Center is a partnership with the Lee County School District. Our United Way runs a gifts in kind program where we're able to get things like brand new shoes, clothes, hygiene products, and school supplies. And we knew at the start of the school year in 2020 that we were going to have a lot of families in need, and that children were going to need clothes, shoes, school supplies. And so we started this program. It's housed right out of the school district. And I'm going to show you a brief video. It's less than 2 minutes, but it's hard for me to explain what this location looks like. You really have to see it for yourself. But I am going to hopefully successfully share this with you. And then I will share a little bit more about this program.
I kind of like to build these things as if I was building for my children. Let's get him a shirt. What is she in need of? Let's see what I have. Because I know that, you know, for the children, it's a big deal.
This is the School Resource Center. This started late last year with a conversation with Dr. Ken Savage. If we had some space at the district office, we would be able to go ahead, fill this room with items for every student in need.
A lot of these students don't have enough money to get some stuff, so we try to provide them as much as we can.
We have clothes, we have shoes, hygiene products, school supplies, backpacks, lunch boxes. We have everything here. We're able to gather these items by the sizes that the child needs and get them out sometimes within 24 hours.
And it goes directly to the school. So the social worker or the counselor or the SRO will receive these.
We feel that each child should have the opportunity to feel good about themselves.
Today we have an 8-year-old third grader and a 9-year-old fourth grader. We're gonna go ahead and fill up for. We need size medium, so I kind of give them a bigger size so they can have one of each. I throw in a couple of extra little things as well for them.
On behalf of the school board members and the superintendent, we would just like to thank United Way and the Price Foundation and so many other donors that are supporting this great impact for our students, not only in the school day, but on the weekends as well.
And that's one box.
So you can see we have just about everything in there, and we do cover from elementary school all the way through high school. In the first year, we thought it was an overwhelming success. Well, I can tell you that for this school year so far, for the 21-22 school year, we've already surpassed the amount of donations that have gone out in the entire previous school year. Over $1.2 million worth of items have been distributed to students in our community. So again, you can see the tremendous need. A lot of what we do, and I originally went to school to be a teacher, and I was in a previous lifetime for a very short time. You know, Maslow's hierarchy of needs, if all of you are familiar with that, you know, the basics, and I'm just going to throw it up here because, you know, to me, our children in our community, and let me go back to share screen. The children in our community, you know, are not going to be able to get to their ultimate potential unless we're working on some of these basic needs. And so, you know, look at the bottom of the pyramid and we're talking air, water, food, shelter, clothing. These are things that we know if we're not meeting these needs for their students, they are not going to be able to concentrate on their studies. The safety needs, and then that feeling of belonging and that esteem, that self-respect. and then they can get to be the most that they're going to be. But if we're not addressing these basic needs, we're not going to get there. And so what we've decided to do is partner with the School District of Lee County and the University of Central Florida to start what are known as community partnership schools. These community partnership schools are amazing, and University of Central Florida has put a lot of time and effort into building these models. And it's based on a partnership, and you have to have 4 basic stakeholders within the community. And so we have the School District of Lee County, we have Lee Health, we also have FGCU, and then United Way. And we actually have staff members embedded in 2 schools. We started out with Franklin Park Elementary School, and then this school year we are also in Fort Myers Middle Academy. And the concept is that we take staff members and embed them in that school, and they're constantly assessing the needs. They are looking at how to bring different services into that school to not only help the children, but help the families and the faculty as well. And I'll just give you an example of how the School Resource Center ties in. We had an actual, a teacher who had a student in her class that was just not paying attention. He was fidgeting, he was just, so she said, you know what, why don't you go down and visit United Way and, just talk to them for a few minutes. Well, come to find out, he was wearing a younger sibling's shoes because his shoes fell apart. These shoes were almost 2 sizes too small for him. Now, ladies on this call, if you've ever worn a pair of heels to a meeting and they are killing your feet, it's hard to pay attention, am I right? So imagine this student really trying to pay attention and learn something in class. And it's just a pair of shoes, but it's a pair of shoes.
10 minutes.
And so we were able to get a new pair of shoes for him, put them on him, send him back to the classroom, and the teacher said it was like night and day. And so sometimes when people say to me, well, I can't give enough or I can't do enough to make a difference, 1 pair of shoes made a difference in the student's life. And to me, we're taking 1 case at a time, we're taking 1 student at a time, 1 pair of shoes at a time to get these students where they need to be. The other thing that we do is we realize that a lot of these students, especially in the middle school, were suffering from that COVID gap of learning. And so FGCU and Florida Southwestern, we've brought in tutors. We have students that are doing tutoring for these kids to get them caught up. We also work with the whole family. So when a student comes down with a need, we're reaching out to the parents. When we have a student who shows up every other week needing a new backpack, we ask why. And we talk to the parents. We'll come to find out they're couch surfing, right? They don't have a home. They're going from house to house of friends, families, neighbors, and they may be in one place for 3 days and they may be in another place for a week. And what's happening is these students don't know where they're going home to. They could be going to the same place they slept last night, or they could be going to a different house. And if it's over the weekend, that backpack's still at the house they were at before when they're not getting it back. So we're working with the parents. Okay, what is your housing situation? What is your employment situation? How can we bring in goodwill to go ahead and do some job counseling with them, help them with a resume? So we're taking a holistic approach and bringing in the services for each school to make sure that we're meeting the needs in that particular area. We've been meeting with school district members, the board members over the past month to really talk to them about the needs of the students and where they see the need for the next community partnership school. And what they've all said every time is that we get more of these community partnership schools in areas in elementary schools, but in areas in Lee County where we know specifically those students are really struggling, we can start to change the story from a very early age. We can change the story with the parents, we can get them involved, we can find out their needs, we can let them know about the resources available. Because unfortunately, we have more people than ever who've never needed help before in their lives, and they don't know where to start. So our goal ultimately is to have several community partnership schools in Lee County and to really start focusing on helping these students as early as we possibly can and letting the parents know that there is support in the area and a community that cares. So I think that's it in a nutshell.
That's
I
great.
could go on and on, but I will stop there. And when we do questions at the end, I'd be happy to answer any of those at that time.
Thank
So
you very much. Thank you. Our next speaker is Therese Everly, the Executive Director of the Lee County Homeless Coalition, and she also serves as a member of the Lee Memorial Health System Board of Directors. Therese has had participated in various areas of healthcare and nonprofit organizations and for over 30 years. She is a graduate of Hodges University with a bachelor's degree in healthcare administration. Therese?
Thank you so much, Jane. It's a pleasure and an honor to be here. And, two great speakers I'm following up on. So we'll see how we do here. So I wear two hats, as you said, in the community. Just this past September, I took over as the Executive Director of the Lee County Homeless Coalition. And I've been serving on the Lee Health Board for 6 years. And I thought that stepping into the role at the Homeless Coalition was a very organic move. Lee Health is a public safety net entity. We are tasked with caring for everybody that comes through our doors. So really, I love Jeannine's slide on, Maslow's hierarchy of needs. And I feel that I serve the bottom two tiers, the first two rungs, the housing and then the healthcare. Just if I may talk a little bit about what the Lee County Homeless Coalition is. The Lee County Homeless Coalition is a nonprofit. And what we're tasked to do is we're considered what's called the co-lead agency with Lee County Human and Veteran Services in the homeless continuum of care. The continuum of care is an infrastructure that is a really system of care around homelessness that's defined through federal requirements. And so the Lee County Homeless Coalition convenes the general membership of the COC, the homeless COC in Lee County. And that's all our community agencies, whether they're funded agencies or not. Being a nonprofit, I have a broad reach. I cast a wide net into different advocacy groups and faith communities. And we convene as the coalition subcommittees working groups. And that's really where a lot of the work happens. It rolls up then to our general coalition meeting that meets monthly. And then it ultimately rolls up to the COC governing board, who then, which I also sit on, who then recommends funding projects to the Board of County Commissioners. So that's basically the system of care, if you will. And so sometimes people get a little confused with what the role is of the coalition. And I hate to say this, but a very long-time person in the community said to me, "You're kind of like the United Way of Homeless Services." Am I allowed to say that, Jeannine? I'm not sure. But for example, I get the calls all day long. I don't case manage. I refer them to United Way and to the other agency partners. So that's basically what we do. We have a very small in-kind program, and our in-kind program goes directly to our agency partners in our faith communities who actually do the actual outreach on the streets and in the different areas of our community. So that's a little bit about the Lee County Homeless Coalition. I've had the great opportunity since taking the role over in September to fully engage with Project Access. This is a project stood up by the Lee County School District. And it's a great team of people that focus on children that are being displaced. And that's their term that they use because of, the known stigma of telling a child they're homeless. So it is displaced. Now, homelessness within the Lee County School District is defined differently than the county defines homelessness, because the county and the Lee County Homeless Coalition use the HUD definition. And HUD is more literal about what homelessness is. So that is literal homelessness, living in something that is not considered inhabitable, like a car or a vehicle, a camper, etc. and or living or sleeping in a public space. No permanent place to sleep at night. Whereas the Lee County School District, and this is a federal act, follows the McKinney-Vento Act, which actually uses the same HUD definition, but also adds basically couch surfing. So if a child becomes homeless because they're doubling up with family members or friends because they've had an economic issue, health concerns, or whatever has caused them to lose their primary housing, that is considered displaced and homeless. Frankly, I'm grateful for that act because I couldn't imagine if we had to use the strict HUD standards to provide care and resources to children under that more strict definition. The Lee County Homeless Coalition, one of the things that they do every year is by requirement, we set the logistics up for what's called Point in Time, which is PIT. We affectionately call it PIT. That's the acronym. And you count the homeless people. It's a homeless census that is done every year annually. And based on those numbers, that will determine how much money comes into the Lee County COC for homeless services. It comes down through the federal government, through the state. There could be also some local funding. So we stood that up at the last 10 days. We went January 26th through the 29th. And I'm proud to say we surveyed more geographic areas than they've ever done in the past. It was quite the logistic feat. We will actually not have the actual count numbers until April because there is a lot of data quality work that needs to be done around that. So once that gets recorded with HUD, we'll be able to talk about what those numbers look like. And I'm sure you can well imagine they will be higher. Last year, the count, the federal government said we did not have to do the count, but the Lee County Homeless Coalition and Lee County Human and Veteran Services said, no, we're going to do it. We're still going to do it. So it wasn't a full count, but we wanted to get out there to see what was happening in our local community. So kudos to Lee County for doing that because HUD did say they didn't have to. So we stand up an annual homeless service day. We did that last week. This is an incidental kind of comment, but I got a lot of feedback from people saying, again, this was my first year hosting this event. They were surprised at how many women were seen homeless. And, I think that is a bit of a trend. Nationally, statewide, shelters are notoriously set up for men. Men are usually the ones that have the highest volume of homelessness. I was, interestingly enough, on a recent national call around homelessness, and they were talking about female veterans. They were seeing an increase in female veterans because those homeless females often come with children. So sheltering families and women is very difficult to do. So that's kind of what's happening in that space. Also, there was something called the Family Transition Collaborative that was stood up by the Lee County Human and Veteran Services, supported by the Board of County Commissioners in May of 2021, where they focused on homeless families or committed couples. This was a first-time program, if you will. You don't want to say it was a pilot because it was done out of necessity. We just got the data back on that. And that first tranche of money that was allocated to that ended up with an 81.9% placement into permanent housing for these families, heads of households in this Family Transition Collaborative. Due to the success, the Lee County Board of County Commissioners just allocated an additional $1.9 million to do the second go around of this program, which is definitely highly needed. That will be the great thing about it is it provides some wraparound services. Centerstone is the behavioral and mental health service provider for those families, and Catholic Charities will be doing their housing and case management. Again, it is public-private partnerships, it's collaboration. We always love when we see those types of things happening. So that's what is we're continuing to see in the housing space. And we also recognize that many people that experience homelessness have behavioral mental health problems. And even last Saturday, I was seeing a lot, I don't want to say a lot, but there is a significant amount. And I know you all see it driving around if you've lived in this community for a while. There seems to be younger homeless people. Youth homelessness is becoming a trend across the country. I was reading an article recently about families that have struggled with young adults, maybe later in their teens, that were having mental health, behavioral health problems. Then COVID hit, and it just became the straw that broke the camel's back for these families. And the children have gone into homelessness because the families just can't sustain it, because they're dealing with their own anxieties, economic impact, etc. So that is something that we will definitely be looking at, studying years from now, the mental health, behavioral health impact of the COVID crisis. So Lee Health, let's talk about Golisano Children's Hospital, because this is more focused around children.
10 minutes.
Okay, so in the last, Lee Health is not the primary behavioral mental health provider. We are a public health entity for acute care, and of course we have outpatient facilities, but the need was so great in the community. So we started building our pediatric behavioral mental health model. It's a proper service line now, and that's something that in my 6 years of service, it's one of the greatest accomplishments right there, that we've moved that to that level. So over the last 5 years working in this space, Lee Health has increased its access to outpatient behavioral mental health services by 1,300%. That's 1300. In 2021, there was over 15,000 behavioral health visits alone. And in 2019, that was only 7,000. So it has gone up dramatically. We recently, from our Chief Human Resource Officer, I thought this was fantastic, and this has been extremely well received, and we can see this by our hiring ability. We have moved the hiring of psychologists to be in line with us hiring physicians. So psychologists used to be hired like nurses, or I'm actually a registered respiratory therapist by way back trade, and they were just considered like regular staff. Well, now they're a part of that hiring mechanism like medical staff is, and that is truly where they belong. And we've also increased the hiring of behavioral health case care navigators, and have invested in something called behavioral response teams. This was a big investment for Lee Health, and BRT is a best practice. And we have in, is it Columbia? I'm not sure. It's one of the, higher institutions of learning that started this. And it's to allow people to be trained to respond to behavioral health crisis in any situation, because we're dealing with this in a very escalated manner in the hospital with violent patients, violent families, and this is all from the COVID crisis. This is something that has just come to a boiling head for us. So that is something that we're working on. In the long term, we're also going to be expanding behavioral mental health services in Fort Myers and Anita Springs. We are working on a partnership with family health centers to provide behavioral mental health in Lehigh Acres and in Cape Coral, and ultimately standing up an intensive outpatient treatment, which is a benefit as opposed to putting the child into a facility. It's what are called Baker Act receiving facilities, which is an inpatient setting, which can be somewhat traumatic. So let's talk a little bit about that. Many of the Baker Acts happen within the Lee County school system, and it's a very traumatic thing for children to go through. So there was prior to the pandemic, with the help of Lee Health and the partnership with Lee County School District, we saw those Baker Acts drop by 50% by identifying who's appropriate and who's not. Well, COVID crisis it's almost like lost ground. So we're trying to lean back in that space, something that Lee Health has done when these children often come to Golisano to be medically cleared or if there's no place for them to go, if say LeSage or the other receiving facilities, they end up at Golisano. So Golisano, when they do discharge them and take them to an inpatient facility, we no longer use law enforcement. That's been the best practice. I don't want to say best practice, the standard of care around the state, frankly. So Lee Health is now using their own public safety to transport these children so they don't feel re-stigmatized after already going through the Baker Act procedure, that now they're leaving the hospital, they're surrounded by care, compassion, put in a Lee Health vehicle and transferred to their next level of care. And we've seen really positive feedback from that. And I think I've just about, one last data point I want to give you. I had the raw numbers, but this will make more sense. When you level set the statistics per 1,000 days in healthcare in the hospital, at Colorado in 2019, per 1,000 days, we would have 0.20 patients per 1,000 days. In 2020, it went up to 12. In 2021, it's 24. So it has doubled from 2020 to 2021, and 2022 is going to be off the chart. So we definitely have a pediatric mental health crisis on our hands, but there is a lot of focus and work being done on it. Okay, that's it.
Thank you very much. And our final presenter will be Tessa LeSage. She serves as the Director of Future Makers Coalition at the Collaboratory. And this is a partner organization, shared goal of transforming Southwest Florida's workforce. Tessa graduated from Boston College with a bachelor's degree and received her master's degree in public administration from Florida Gulf Coast University. Tessa.
All right. Good morning, everybody.
Good morning.
Happy Saturday. These are tough things to hear about on a Saturday, I must say. Can everyone see my screen? Thumbs up? Yes. Okay, great. I think the one thing I just want to say, after listening to my amazing colleagues here, is that all of these things are connected, right? All of these things are connected. None of these things are easy to solve. And if you're familiar with Collaboratory, where I work and have the privilege of helping to get us to where we are today in terms of understanding what it really is going to take to make community change. We are very focused on collaboration. It is in our name, right? So we believe that collaboration is key to solving these problems. We're determined to solve these problems together, but collaboration is not easy. And so Future Makers, what I'm going to talk to you a little bit about here today, is really just an example of how you can work together to change outcomes and to change systems. So whether you're interested in Future Makers or not, when we're done here, which I hope you will be, because really Future Makers is about shifting our culture and the way we think about our education and workforce outcomes and systems. No matter what you think of Future Makers, it does provide a really nice example, a replicable example of how you can collaborate to solve any of our community's problems. So with that, let's talk a little bit about the problems that Future Makers is trying to solve. So I'm sure you've heard that we have a workforce problem. It's not just us, it's around the country. We see a lot of challenges with it. Slow service, people can't be found to work to wash dishes. My friend at the veranda told me that they're paying $18 an hour for dishwashers right now. And then that just gets even bigger. We know Lee Health, I don't know what the stats are today. I missed my healthcare system alignment meeting, but I mean, well over 1,000 vacancies a day. Some of these in very, very important positions, and we're working closely with them to try to address that. You have this jobs that you can get, with very little education, and then there's the jobs that require really extensive skills and are very specialized, and all are hard to fill right now. All of those are hard to fill. So workforce is one of our biggest problems. Here's the thing though, it's not just because of COVID. It was a problem before. In fact, when you're looking at problems, we can look at things at a very high level, at a regional level, at a state level, at a global level even. And the idea for Future Makers actually grew from a study that Collaboratory, then the Southwest Florida Community Foundation, did in 2012 to find out what were the biggest challenges in our area, because we wanted to experiment in this idea of working together. Could we work together as a region, 5-county region, that includes Hendry, Glades, Charlotte, Lee, and Collier counties, to solve a problem, something that we currently weren't addressing or that couldn't be addressed on its own. And so the two things that rose to the top in 2012 were education, and these are the Sustainable Development Goals. We align Future Makers outcomes and work with these global goals, because in order for us as a planet to meet these global goals, it all starts locally. So we've taken the time to think about how we can align with those goals. So the two things that rose to the top were education and decent work and economic growth. Those are two of our biggest problems still today. And so I don't think anyone would be surprised about that. But a group of really determined community leaders came together around those things and decided that let's do something together to see if we can move the needle on these outcomes. And really, we've done a lot of work. We've made a lot of progress, but there's still so much more to be done. But one of the most important things that we've learned in this time is that it takes a very special type of skills to work together to change outcomes on a big scale like that. And so what is systems change? Future Makers is focused on systems change. There's no single solution that's going to fix our education and workforce challenges. There's no single solution that will fix our mental health challenges. The homelessness, there's no one thing. And that means that no single entity can fix these problems. We can't look at a school district and say, fix 3rd grade reading proficiency. It's not all on them. And you can hear that in some of the presentations that we heard today, this like entangled web of the problems that are resulting in these outcomes. A technical college can't fix it. We can produce CNAs all day long and we're still going to have trouble hiring CNAs. Our colleges and universities can't fix it. A nonprofit can't fix it. Our biggest employers like Lee Health can't fix it. Bank of America can't fix it. Neogenomics can't fix it. Like, we all have to work together. Eliminating big social problems requires collective work. And we only dissolve our education and workforce problems when we focus on redesigning systems. And that's really what Future Makers is about. The system, so what does that mean? What is the system? The system is the way we work together. It's our relationships. And we have to have trust and the ability to work together to really start to change systems. So can we mute that possibly? Thank you. All right. So systems are really, is that blurry? Oh, there we go. Systems, there's two complementary forms of leadership. And one is organizational leadership. That's how we work in our organizations, very much top down. You all are probably familiar with this idea. But what Future Makers is focused on, and what is the example for collaboration, is really something more based on collective leadership. So it's relational, it's self-organized, it's built on trust, it's less formal. Future Makers doesn't have a board, we have a guiding team. And it really requires networks. It requires networks of people working together, both individually in their day job and coming together around bigger problems. It's important to see the differences in these forms of leadership when we're trying to work on big community issues, and like Future Makers' effort to transform the workforce. So how do we do it? Future Makers is designed, I don't understand why it keeps being blurry, sorry. Future Makers is designed with the system in mind. We take a cradle to career approach. We focus on the whole talent pipeline. We believe workforce development starts with early childhood education. We use data. We don't do anything without data. We don't do anything just because it feels good, or we think it makes us feel like we're really, giving back to the community. We want to make sure things are working and changing outcomes. And equity is at the core and center of everything that we do. If you look at the data, And I put a link in the chat to our website. All of our reports, everything is public source. Anyone can use it. It's for our partners. Feel free to check it out. But if you look at the data, it is very, very clear that our current education and workforce systems are designed for what is now the minority of students, which are the white students in our system. The Latinx and Hispanic and Black students make up the vast majority of the students in our K through 12 system right now, and their outcomes demonstrate that the system is not serving everybody. And so those are things that we're very, very focused on with Future Makers. So we are designed with teams in mind. We have folks working on pre-K to graduating from high school, the folks that are working on the transition from high school to post-secondary education, and then the folks that are working on getting done with post-secondary education, because getting in is just the beginning of the work, and then getting connected to a job here in Southwest Florida. We are very committed to this concept that talent lives here. We don't need to be constantly trying to recruit people from outside. The companies that are doing that right now are struggling to keep them here because they're not rooted in this community. It's more costly to do that. We have talent right here that we need to be focused on. So does it work? There's a whole concept of this idea. Well, that sounds really fluffy, right? This whole idea of collaboration. Does it work? So Future Makers goal, as you can see from my shirt and from this slide here, is 55%. We are focused on transforming Southwest Florida's workforce by increasing the number of working age adults. So those are folks that are age 25 to 64 that have the credentials that are needed to fill in-demand jobs in Southwest Florida by 2025. Right now, only 41.5%, only 41.5%, nearly 60% of the folks that are age 25 to 64 in Southwest Florida don't have a credential beyond high school. Many probably don't even have a high school diploma or a GED. And that is a crisis. We're below the state, we're below the country, and we have a lot of work to be done. We know that by the year 2025, 2 out of every 3 jobs will require a credential beyond high school diploma in the state of Florida. And almost 60% of the folks that live here that are working age don't have those credentials. So here's a timeline, 10 minutes. Here's a timeline of some of the things we've been doing. You can't see it because for some reason it's blurry, but I'm going to walk you through. We've been doing a lot. One thing I want to point out that was mentioned earlier, we were designated a talent hub in 2020. That's a very big deal. We're one of only 25 communities across the country. We're up there with LA, Boston, Nashville, as recognized as an exemplar for the way that we work together and our ability to change outcomes. Some of the things we do together, we work on FAFSA, and I have to give Jeannine a huge shout out for this. Her VITA volunteers don't just do all those taxes and bring all that money back into this community. They're also really focused on helping folks fill out the FAFSA. This is financial aid. We've left millions of dollars on the table in financial aid that could be helping students go to technical college and college because people aren't filling out the FAFSA. It's a robust team that's working hard on that. And they're amazing. And that's a great way to get involved and to help if it's something that you're interested in doing that can help us reach our goal. We do a student voice summit. And again, this is on the website. I don't know why it's blurry. But we do a student voice summit where we actually go to students and ask them why are the outcomes the way that they are? Why are they bad? They give us feedback. And we've been doing that for years. All the reports are on the website. But in the last couple of years, we focused on COVID, and the students are reporting very significant issues related to mental health, just as we've heard earlier, and also discrimination. 70% of high school students in Southwest Florida say that discrimination is impacting their ability to meet their education goals. We have worked on early childhood education. We're really trying to bridge that gap between folks that are kids that are transitioning from pre-K to K. If by the time they get to kindergarten, they may already be so far behind if we don't have quality pre-K and we don't work together to make sure that those transitions are good. And not to mention all the problems that we have with pre-K related to COVID with the early childhood providers closing over the last couple of years. We do a conversation about structural racism and implicit bias. What we've noticed over the years, we've been very focused on equity. Our community doesn't feel comfortable talking about race, racism, structural racism, and implicit bias. So it's hard to even understand it if we don't feel comfortable talking about it. So we've created an introductory conversation. They're on our website if anyone wants to sign up to participate with a group of volunteers that are really just introducing these ideas and helping us start to explore them together. Our hope is that then others will move to the next phase and to continue to work on these issues because it's impacting our education and workforce system tremendously. We've grown our partnerships with employers, and we have a lot of employers that are working directly with us to try to create business and education partnerships to ensure our systems are serving the needs of our employers. Nobody wants to go to school and then not be able to get a job. We have a podcast. I really think this is a great way that you can help us if you listen to podcasts. We're on all the platforms. And we're telling local stories and telling things about what we're doing here, not only in hopes of getting attention to Southwest Florida, hopefully bringing in other resources, but also to help others get involved in these changes. We have some really, really cool stories that we've shared there. We've started we like to visualize systems. Systems are invisible, and that's why they're so hard to change. We have a whole section on our website now that are visualizing career pathways so folks can understand what a career can be like in some of our top industries, and we hope to do more of that. We have a workforce ecosystem on our website too, another invisible system. You can't see all the entities that go into education and workforce systems. This is on our website. It can help you navigate sort of who to get involved with, who are the players. So that's available too. We did a partnership health report also on the website under resources in our reports. You can't see this, but we know that it's working because about 60% of our partners said that when they go back to work every day after being part of Future Makers, Future Makers has impacted the way they do their jobs. And 40% said that they have changed policies and practices, specifically around being more student focused and around diversity, equity, and inclusion. That is huge. We grew our team this year. We have now, because thanks to Bank of America, we have a new program. It's called Navigate. It's our Graduate Southwest Florida Navigator program. Navigators are free. It's also on our website. They are free for any adult who wishes to go back to school, finish a GED, learn English, finish a credential, finish a degree, start a degree, start technical college. We will walk alongside them and work with our partners to try to remove all the barriers. We need help getting the word out about this so that those 60% of adults have the opportunity to earn the credentials they need and fill those jobs. So I am going to stop there, and then I'll happy to answer any questions that come along.
Good morning. This is Eileen Conroy, and I serve as first vice chair, leading communications and public relations. Thank you. That was fabulous. Thank you all the panelists and Dana for organizing this. So I'm going to, you can ask questions in addition to the chat using the chat function, which is on the bottom of your screen. There's also a button called reactions, and you can raise your hand. But I'll lead off. We have received 2 questions in the chat. So the first is from Marge Tingley, and all of the panelists could address this question. It wasn't directed to just one. The question from Margie, is federal funding effective? So that's a broad category, federal funding. I don't know, Margie, if you want to focus in, or if the panelists want to take an example of federal funding, why it's effective or where it's not effective, how that could be solved.
I just wanted to ask that question in the sense that I feel like there's more and more federal funding for so many things that we're talking about here in the Build Back Better Act. And I know right now it's primarily about infrastructure, but there's also been rent help, anti-eviction help, childcare help, etc. Was that worth it, is what I'm asking.
Thank you.
And
I'm
no, go ahead, Dr. Dollard, you can go first. That's fine.
I was just going to say that yes, it is working. Let's just say federal policy in general. For example, the child tax credit, I'm not sure you're familiar with it, but under the American Rescue Plan last year, and we're hoping with that it will be made permanent, families were able to get their child tax credits on a monthly basis for the second half of the year. And families who were, who ordinarily would not file for taxes because they don't have enough income, were able to take advantage of this tax credit, and it was substantial. And the estimates are that 40% of kids were lifted out of poverty by that one intervention. And that's making that tax credit permanent would really, go a very long way to reducing poverty on a permanent basis in our state. I can think of lots of other examples, but I'll let Jeannine go.
I can just give you a couple examples. We had the CARES Act dollars come through in 2020. And that was the one thing I referenced about United Way working with the county to be able to do those $2 million in childcare scholarships. And I do want to commend our county, because what's happening is these dollars are coming into the local government. And, there's a lot of red tape and a lot of bureaucracy, and these federal dollars come with a lot of hoops you got to jump through. And the last thing we want is to have to repay these dollars. And so, we were very careful with what we did with the CARES Act and the money there. And the county was forward thinking in allowing some of the outside nonprofits to join in this. And I'm excited to say that, we will be announcing a notice of funding opportunities. We are working with the county on a $20 million ARPA budget. And, United Way does about 11.3 million a year to local nonprofits and programs and everything in our area. This is $20 million over a 2.5-year time span. We'll be opening it up to nonprofits in the area. And these dollars, what we're really hoping it's transformational, that, we'll be able to beef up some programs that are already there, bring in some new programs, but also on the back end, offer some, sustainability dollars as well. So when these ARPA dollars are gone in 2.5 years, that they'll be able to continue these programs. And that might involve hiring their own grant person on staff, which they may never have had before. So they do work, but especially when you're able to infuse the dollars into the nonprofit structure within the community to allow more programs to really thrive.
All right.
This is,
Okay, go ahead, Therese.
Go ahead.
Yeah, so just from the housing perspective, there's a lot of American Rescue Act money coming into all these different communities. And I do agree with all the speakers, there are these great programs that are being stood up. However, I do have a bit of frustration because it is a tremendous amount of money. And HUD currently does not have a strategic plan for housing. And so to be sitting in a meeting on a national level to say, and listening to them say, you have to have a strategic plan around your local communities. They're looking for an ROI. There's a lot of work around HUD and Health and Human Services coming together. There's a collaboration on the federal level, which again are those two tiers of, the hierarchy of needs. But it's a bit frustrating, and everybody on the call felt that way. And so hopefully, you're going to hold us accountable for a strategic plan and wraparound services, yet we don't have anything really to follow from the federal perspective, but they're hoping they will have a plan by May. So to Jeannine's point, you always get a little nervous because, they do have the opportunity to say, hey, we want that back. That didn't go the way we wanted it to go. So that's my honest perspective of what's currently going on.
Thank you. Tessa, did you want to add to this question? We do have another question relative to your area, if you'd like me to go to that.
Sure, you can go.
Okay, from Dr. Antoinette Cruz. Hi, Tessa, great presentation. Can you provide us with insight into the university thinking on the achievement gap and how they plan to contribute to solving disparities?
So that's a great question. Thank you. I think there is a lot of, I'll speak locally. We've done a lot of work with our local institutions. We are looking at what is unfortunately called non-traditional students. And I actually think that non-traditional students are now the traditional students. So the vision that we all have of a college student, which is usually a white male coming out of, a family legacy of going to UF or wherever the case may be, right? That is actually nationally, I think somewhere around 16 or 17% of college students, kids who can go, their parents are paying for it. They are able to just make it in 4 years. They might not have to work, all those things. Now, the vast majority of students are not in that situation anymore. And that's why we see like a graduation rate of like 48% in higher ed, which is really very, very scary. Because if you start and you don't finish, that's worse than if you never started at all. And more than 50% are not finishing, which is crazy. And so what we've been doing is we've been working really hard, especially as part of our Talent Hub acceleration work, to figure out what is making students stop out and what are the policies and practices that need to be changed to fix that. So we did a huge concerted effort beginning in 2020 through part of 2021 to identify 20,000 stopouts from FGCU and FSW and to see what it would take to bring them back. And we brought back in 2020, 800 Southwest Floridians who stopped out. And within the first semester or two, we awarded over 100 degrees. So these are folks that literally only have just a little bit more to go in order. Sometimes it's a fee, or they didn't apply for graduation, or something silly like that stopped them from getting a degree. We've started a debt forgiveness program to work with forgiving some debt so that folks can go back and finish. No one's allowed to have their transcripts if they have debt. That's in my opinion, a crime. How are you ever going to get ahead if you can't get your transcript? So we're looking at things like that. We have a task force at FGCU that's been formed with future makers to really look at why are students stopping out. We're bringing them back, but we're also asking them, why did you stop out? What was it? What could we have done better? What does it take now for you to finish? We're trying to focus more on Southwest Florida's adult learners, focusing on folks from Southwest Florida, because really that's where we need to grow this talent. It's one thing to have folks come here and get a degree and then leave. And then it's a whole other thing to get them to stay here and be able to have their families here. And when we talk about stopouts, we're talking about the parents of the kids in our school system right now. So we're not only trying to right or wrong, we're trying to also take what we can from those folks to understand how we prevent it from happening again in the first place. So I don't know if that answers your question, but hopefully it gives you a little bit of insight of some of the things we're doing locally, at least, to try to decrease disparities. And of course, those disparities are highest among first gen and our Black and Brown students. And so that's, obviously that's where we really need to right a lot of our wrongs and fix policy.
Thank you very much.
I just wanted,
Can I just kind of thank you for your response, but as a former professor in 2 of the major schools in this area, I'll just share some of the feedback that I received as an instructor. And many of the students of color were looking for other professors of color. And that was also another huge indicator of the types of universities that they wanted to participate in and get their education. So that's a lived experience, that's real live data. So use that, take that back to your tables and talk about it.
Thank you.
Thank you, Dr. Cruz. What I wanted to share, I know
Can I just say one thing? Thank you for sharing that lived experience. That's the most valuable information that we can have. Talking to the people who experience the system is the key to making the system actually work. And secondly, you are 100% right. And I appreciate your feedback.
Thank you, Tessa.
So I know we're coming close to the end of our program. I just wanted to share an answer that Jeannine gave the question was, how can you contribute to the School Resource Center? And the answer is, it's a United Way program, and you can, in the chat, Jeannine published this, but for those that haven't seen it, you can send United Way or donate online at unitedwaylee.org. Thank you.
Well, that is a big dose for Saturday morning. In the words of Nelson Mandela, he said, "Fools multiply when wise men are silent." And I think the thoughts today prove to us that we can't be silent. We can't remain silent. We hope you will work with the League of Women Voters to address the issues that were discussed today. As members of the League, you could join our Social Policy Committee, because we're charged with dealing with homelessness, affordable housing, juvenile justice, and human resources. What can we do to help you work more effectively? I think that there's a lot that we could do. And I just want to speak as a nurse and a college vice president. We had very difficult, and I come from the Northeast, but we had great difficulty with our creditors because we could not attract professors from diverse populations to come to very small area in Northeastern Pennsylvania. So part of the inability to address the needs of the so-called non-traditional students, you're correct. It's that they have to see themselves, but it's very difficult to hire them as a college administrator to get them to come. So there are those of us who are educators, who are former healthcare providers, who are business leaders, who are in the League, and those who are friends of the League, who see the need now. And hopefully we will be able to work more effectively with you to effect some changes. And thank you very much for your work today. It's just marvelous.
Thanks, Dana. Thanks to you and your committee and our 4 excellent speakers. Before we close the meeting, I would first of all like to invite any of the people on this presentation who are not members of the League to join us. We would love to have you as members. I'd like to tell people that our next meeting on March 5th will be a discussion of voting rights with Tommy Doyle, the head of the voting department in the county. On April 2nd, it will be a meeting on climate change and our annual meeting for members of the League. On May 7th, we will have a meeting on juvenile justice. I'd also like to encourage anyone who would like to be on the board to notify one of the members of the nominating committee, which is on our website, to tell them of your interest in joining the board. Thanks to everyone for today, and we will close the meeting now.
Thank you.